Hi everybody, welcome to Dr. Manny's YouTube Leanshops. This is part 2 of this component which looks at nursing and health, the pragmatic perspectives in qualitative research. The learning outcomes for this session are to again look at qualitative research and how it's defined, the pragmatic perspectives related to conductive qualitative research, and we're being realistic about the methods related to 5 common research approaches. Okay, let's just reinforce qualitative research, that the aim of qualitative research is to understand the subjective reality of the study's participants. This is not going to be achieved through superficial knowledge about large representative samples of individuals as we do in quantitative research. Rather, we as nurses or qualitative researchers want to reach people within the study area who can share their unique slice of reality, their ontology, how they perceive the world, so that all the slices together illustrate the range of variation within the studied area. The best research you can do is to talk to people. This is qualitative. This requires research literacy, the capacity to think critically, use analytical skills, do a competent literature search to gain relevant data as evidence. Have a critical understanding of the research process that you're employing, which means you have to have the ability to read and appraise research and other evidence. And always be aware of ethical research issues, the axiology. Research has been defined in many ways. So therefore let's define it again and then redefine it so that everybody's clear. Research comes from French chercher, meaning to search or locate. And even the prefix re in the word research means again and signifies replication of the search. To re-look, to search again. One seeks new knowledge or to directly utilize knowledge specific to life situations. Webster in 1971 defined it as research is the studious inquiry or examination, investigation or experimentation aimed at the discovery and interpretation of facts, revision of accepted theories or laws in light of new facts, or pragmatic, practical applications of such new or revised theories or laws. Treese and Treese in 1973 stated, research is an attempt to gain solutions to problems. It's the collection of data in a rigorously controlled situation for the purpose of prediction or explanation. This is quantitative terminology. Best in 1968 stated, research is a formal, systematic and intensive process of carrying on a specific analysis for the purpose of discovery and development of an organized body of knowledge. This could relate to both quantitative or qualitative methodologies. Pollock and Beck in 2004 defined it as the systematic inquiry designed to develop knowledge about issues of importance to the nursing profession. So this is about nursing, which includes nursing practice, education, administration and informatics. Birds and Grove, however, in 2005, defined nursing research as a scientific process that validates and refines existing knowledge and generates new knowledge that directly or indirectly influences clinical nursing practice, which is introducing evidence-based nursing. Then you've got Vreeland in 1973 stated that nursing research is concerned with the systematic study and assessment of nursing problems or phenomena, finding ways to improve nursing practice and patient care through creative studies, initiating and evaluating change, and taking action to make sure new knowledge is useful in nursing. Again, emphasizing evidence-based practice. Treese and Treese in 73 stated that nursing research this time includes the breadth and depth of the discipline of nursing and the rehabilitative, therapeutic and preventative aspects of nursing, as well as the preparation of practitioners and personnel involved in the total nursing care sphere. Then, according to the National Centre of Nursing Research, which we discussed previously, in 1998 they stated that nursing research is the testing of knowledge that can be used to guide nursing practice, and it's concerned with examining questions and verifying interventions based on human experiences. This is qualitative. It focuses on quality. So, when it comes to nursing research, there are certain sources of knowledge. And this acronym CASTLE is a good way of remembering it. C, customs and tradition. We've always done it that way. Doesn't mean it's evidence-based. A, assembled information. This is from qualitative or quality improvement data, as an example. Then you've got S, scientific research, which is the most objective and the source of nursing knowledge. Then you've got T, trial and error. If it works, we'll use it. L, logical reasoning, which can be inductive or deductive. And E, listening to experts or authorities on that knowledge base. Sources of knowledge then are things like tradition, borrowing from other disciplines, observing, role modelling and mentorship, logical reasoning, using the scientific approach or intuition, your gut feeling, trial and error, experience, and listening to authorities on the subject. So what's the purpose of nursing research then? It's to identify, describe, explore, explain, predict and control. Now I found this quote quite interesting too, from Stephen Wright, a notable author. To steal ideas from one person is plagiarism. To steal ideas from many is research. Defining qualitative research. Qualitative research is a loosely defined category of research designs or models, all of which elicit verbal, visual, tactile, olfactory and gustatory data in the form of descriptive stories, narratives like field notes, recordings or other transcriptions from audio and videotapes, and other written records which could include pictures or films. And it's interesting, this quote from Christian Malzberg, it may be possible to predict a customer's next mouse click or purchase, but no amount of quantitative data can tell you why he or she made that click or purchase. Without that insight, companies or researchers cannot close the complexity gap. Implying qualitative research is very, very important, as is quantitative research, but it gives you more insight into the person, the human being. They're not numbers. Qualitative research, what is it? The development of concepts which help us to understand social phenomena in the natural rather than an experimental setting, giving due emphasis to meanings, experiences and views of the participants. Subjective, not objective data. Albert Einstein, who was one of the most important scientists of our century, and he stated, qualitative research, not everything that can be counted counts, and not everything that counts can be counted. Which basically means that here, not everything can be counted that counts. Quantitative research doesn't always tell you everything. And yet, not everything that counts can be counted. Which means qualitative research can provide you with a lot of information that is important. So, what is qualitative research then? Well, it's research, as we've emphasised previously, over and over again. It's research that uses text, pictures, not numbers or statistics. It takes a holistic approach and tells a specific story. It answers questions to complex phenomena. It describes specific phenomena so that we understand it. It builds on you, the researcher's ability to analyse and make sense of phenomena. Yes, it's more time consuming. However, it provides tentative answers to what was observed or identified. And it is often subjective, but if used within a quantitative methodology, can also be objective, mixed methodologies. And it uses an inductive reasoning approach rather than just purely deductive. And note, objective methods appropriate for studying physical events such as electricity, chemical reactions, black holes, Stephen Hawking, but not desirable or possible when we look at human relationships or events or social structures. Major qualitative research, as we've explained previously, include ethnography, which focuses on the sociology of meaning through observation of socio-cultural phenomena, which is typically related to a specific community. Then you've got phenomenology, which is an approach that attempts to understand people's perceptions, their lived experiences, perspectives, and comprehension of a phenomenon in a particular situation. In essence, what the participant is experiencing. Then you've got grounded theory. And in grounded theory, this is a theory that's generated inductively and grounded in and from a massive body of data acquired by the researcher. You have content analysis, which is a detailed and very systematic examination of content from a particular body of data for the purpose of identifying patterns, themes, or biases within that material. Then you've got case studies. And case studies try to reveal insights on phenomena by studying the phenomena in a single case in depth. The case can be an individual person, event, and even a group or an institution. So, when do we choose a qualitative approach? Well, in a qualitative approach, we describe, interpret, verify, and evaluate. So, description, it allows researchers to reveal the nature of a certain situation, setting, process, relationship, system, or even people. The interpretation, this provides researchers with new insights about a particular phenomenon. It allows researchers to develop new concepts or perspectives about that phenomenon. It offers researchers the opportunity to reveal the problems that exist within a phenomenon, and it allows researchers to verify, validate the trustworthiness of certain assumptions, claims, theories, or generalizations within real-world contexts. And it allows evaluation, so researchers can judge the effectiveness of their policies, practices, and innovations. Let's review now again so that we understand what we're talking about. If we look at the first approach that we mentioned previously, ethnography, as a qualitative research design, it was introduced early, one of the first. And ethnography actually comes from the Greek, which means ethnos, or nation. Graph is writing. And it was first used in cultural anthropology, but however is now utilised, as we've mentioned previously, in sociology, education, psychology, and nursing, and many other disciplines as well. And it refers to the qualitative description of human social phenomena based on observational fieldwork. It's a holistic approach that focuses on an entire group or community that share a common culture and are studied in their natural environment. The setting, this is for extended periods of time, which can be for months or years. And it focuses on investigation of everyday behaviours such as language, rituals, interactions, and other cultural patterns. However, it requires the researcher to be patient and be open-minded. And this could include nursing. Nursing is a culture. Nurses are an entire group of people. They have their own language, rituals, interactions, and cultural patterns. So what's the methodology? The methodology in ethnography is to gain access to the setting. And if you gain access to the setting, you are able, possibly, to answer the research question. Researchers, however, should have no vested interest in the outcome of the study. And it requires a gatekeeper who provides unproblematic entrance into the setting or site. You need permission. It also establishes that you have rapport and trust with the participants being studied. So you require openness and honesty about why you're doing the study. They need to be aware of that. Data collection basically is interaction with the participants to develop a sense of cultural context, identify sources of information, such as important informants that can give you information. And your role is to observe, interview, and record field notes. So, what are the data analysis steps? As we mentioned previously, it's to describe, description. Describe events in a chronological order, describe group or group individual activities, focus on a critical group event, and then develop a story. As far as the analysis goes, you categorize data according to the meaning, and you're identifying patterns, regular, meaning standard or normal, and critical events that are not normal. and your role is to interpret the general nature of the culture from your analysis. Utilize existing theoretical frameworks for support if they're available, and use rigorous subjectivity as objectivity is not realistic in this situation. You've got to make the interpretations. Qualitative research is about subjectivity. It's not about objectivity. It's not about being neutral. Then when it comes to the research report, this is a personal report, which is rarely impersonal. It's rarely objective. It's subjective. So there should be an introduction which provides a rationale and a context for the study. And this is not unique to ethnography. It presents the research question and describes why the study was important. The setting and methods, this is where you describe the studied group and the methods that you used. And it's a graphic, detailed description for the benefit of the person reading to understand what you've done and where you've done it and why you've done it. You analyse the studied culture, so this is where you describe patterns, themes, the practices that you observed. Again, not unique to ethnography. And you present in vivo transcripts as evidence, which means actual transcripts from the participants. And in doing so, you offer transparency. Again, not unique to ethnography. And then you provide a conclusion. You relate the findings of the research to the research question, concepts and theories. And again, you employ the participant's voice. And this is done using in vivo transcripts. If we review phenomenology, well, phenomenology is about phenomena, the study of phenomena. And it refers to a person's perception of the meaning of an event, their ontology, their perception of reality, as opposed to the event as it exists external to the person. This is not about quantitative, it's about qualitative. And even if you look at the diagram there, everyone, every human, every person has got a different perception. They can be similar, but they're different. So, for example, they're looking at that elephant there, and they're saying, oh, gee, it's a fan, a spear, a snake, a tree, a wall, a rope. It's probably true, but every perception is different. So in a phenomenological study, this attempts to understand people's perceptions, perspectives, and comprehension of a particular situation. In essence, what did they as an individual actually experience? The researcher, however, may have had previous similar experiences with the phenomenon being researched and wants to gain additional insights from the experiences of other people. What did they experience? And this may also provide transparent insights from their perspective. Similar, but possibly a different lived experience. When it comes to the methodology, you have to have an inclusion criteria. So this is a purposive sample, which we've mentioned previously, of participants who must have had direct experience with the phenomenon being studied. Otherwise, there's no point including them. The data collection tools can be semi or unstructured interview questions. They're typically open-ended and probing. And look, I mean, the interviews can last anything from 30 minutes to 2 hours. But this is made very clear to the participants. The sample size typically is from 5 to 25 participants, but sometimes we employ data saturation. The researcher should employ bracketing to avoid bias. So this is where the researcher suspends any preconceived notions or personal experiences that may influence the participants in providing data. What are the data analysis steps then? Well, first we identify statements or themes that relate to the topic. And the themes are sorted into groups, clusters, categories, subcategories. And the group statements, once they've been categorized, can be units, categories, or classifications. And these reflect the aspects, meanings of the phenomena that were experienced. Then the researcher searches for different perspectives. And this is to explore and consider the diverse ways, the different ways participants experience the phenomena. And then it's up to the researcher or the analyst to construct a composite which focuses on themes that are common. Despite the diversity of the data, you look for common themes. And the final result is a generalized description of the phenomena as seen through the eyes of those participants who have lived it, who have experienced it. In the research report, this is where the research problem and question are presented. You describe the methods of data collection and how you analyse the data. You describe your conclusions about the phenomena. And you discuss the practical implications of the study and findings and state the recommendations for the study outcomes. And this is disseminated not only to the participants, but possibly to other participants or other related disciplines that could benefit from the study. Grounded theory can be quantitative, qualitative, or used as a mixed method research design. However, we're going to review it as a qualitative research approach. And this approach uses new data to create a new theory. It uses a prescribed set of procedures to analyse data which has been collected in the field, not from the literature. In grounded theory, depending of course which grounded theory approach you utilise, you're not supposed to look at the literature. There's no literature review initially. You only review the literature following your analysis of some of your collected data. And it focuses on a process related to a particular topic with the goal to develop a theory about the process. That's what's referred to as grounded theory, because the theory is grounded in the data that you have collected and already begun to analyse. And it's helpful when current theories about a phenomena don't exist, or they're not really very, very good. They're inadequate. When it comes to the methodology, data collection is iterative. It's cyclic. And the researcher collects extensive data on individuals, programs, events on which the study is focused on, such as observations, interviews, documents, past records, audio tapes, videotapes, photographs, any form of data. And data analysis, this is where the researcher identifies codes, themes, generates subcategories, categories, which are constantly reviewed and revised. This is called the constant comparison method. And this is employed in grounded theory approaches. And this is done until data saturation occurs, which means simply no new or additional data is being generated in your data collection. The data analysis steps are variable. I've tried to keep it simplified, but depending on the grounded theory approach that you use, they will have specific steps. However, most of them employ open coding, which is reducing raw data that you've just got to codes and themes about the phenomenon under investigation, which leads into axial coding, which basically means creating axes or making connections between themes and categories about the phenomenon under investigation. This can lead into selective coding, which is further reducing and combining subcategories into more selective categories. You're reducing the data constantly by constantly comparing it. The constant comparison method. And the eventual aim is to identify a core category, one that explains all the subcategories. And then, eventually, theory development, which is forming a statement, model, or hypothesis from the data to explain the phenomenon under investigation. So when it comes to writing the research report, you state the research problem and the question. You review the literature for the rationale and context of the study, not initially. Sometimes you're allowed to, a little bit. It depends on the grounded theory approach that you're taking. But you don't look at the concepts or the theories, otherwise this could contaminate your data. You describe the methods for data collection and analysis. You describe the process of the constant comparison technique, which propels the data collection. You explain the codes, themes, categories, subcategories, and then you identify and state the core categories. And you present the theory, and you discuss the implications and recommendations. And sometimes you can actually make a hypothesis, but it isn't mandatory in grounded theory. But some grounded theory researchers do have a hypothesis, which other quantitative researchers or qualitative researchers can then review or test. Now let's look at content analysis. And content analysis is a research approach that details and systematically examines contents from a particular body of material to identify patterns, themes, or biases. And typically it's performed on forms of human communication such as books, newspaper, articles, journals, films, videos, etc. And it requires considerable preparation to acquire the content. It's time consuming too. However, it can be incorporated into other forms of research to assist analysis, such as cross-sectional studies and quasi-experimental studies, which are typically quantitative. As an overview, it's a research approach that identifies a specific body of material to be studied. Small amounts of material can be studied in their entirety, or you can have large amounts that are sampled randomly. Materials for analysis, as I said, include books, documents, and transcripts. And when analysis judgments are objective, such as identifying a specific word in a text, you only need one reviewer, one analyzer, one evaluator. However, when analysis judgments are subjective, such as evaluating a behaviour for an activity, then multiple evaluators are required and a composite of their judgments are used to make sure that the interpretation is correct. Because subjective reviews are often different. So the data analysis steps for content analysis then are, using a quantitative approach to tabulate the frequency of each characteristic found in material. You can have statistical analysis, which is often performed on the frequencies or percentages to determine whether the significant differences exist relevant to the research question. Tabulations and statistical analysis are used to interpret data as they reflect the research problem being investigated. Even though it's qualitative, there's a lot of quantitative methodology comes into content analysis. The research report describes the material being studied, so it describes the studied materials and the sampling procedures, if any were employed. There's a precise definition and description of the investigated characteristics, and this is where the researcher defines each characteristic clearly so that other researchers can replicate the study. And it considers using examples from the data to illustrate each characteristic. There's a description of the rating procedure, and this is where the researcher describes the rating procedure used to evaluate the material and how multiple ratings were combined. Tabulation of each characteristics basically reports frequencies and percentages, or both, for each characteristics, and considers using graphs or tables to display that information. The descriptions of the identified patterns is where themes or trends in the studied materials were identified. When we look at our final qualitative research design, we're looking at case studies. A case study then is a research approach that studies a particular individual or event in depth for a defined period of time. Examples can include studying the effect of a medication on a particular patient, studying the effectiveness of a healthcare campaign for a patient, studying the level of improvement in educational achievement on a student given a new learning regime, online for example. Researchers may study 2 or more cases to make comparisons to build a theory or propose generalizations, which are referred to as a collective case study. What's the methodology? Well, if you collect case study data, this can be on site as well, and this is using observations, interviews, documents, photographs, audiovisuals, or past historical records, or just past patient records. The researcher gathers background information that may affect the situation. This deals with the physical environment, historical factors, economical factors, social factors. What are the data analysis steps? 1, organise details about the case, and this basically means facts are organised in a logical order. You categorise data, and this is where data is clustered into meaningful groups. Again, you're really creating categories or subcategories. You interpret the details, where the researcher examines specific documents, events, occurrences that may be relevant to the case. And next, you identify patterns, where underlying patterns, themes are identified to illustrate the case more broadly. And then the final step being to synthesize and generalize, to construct a portrait about the case with conclusions that may have implications for external situations that are not related to this specific case, but they may have implications for other cases, individual or group. So the research report should include the following: the case study rationale, and this is where you describe the studied materials and sampling procedures, if any. There's a detailed description of the case's related facts. So this is where you describe all the objects, events, individuals connected to the case, and you have to be very, very thorough, and often you have to be objective. You discuss the identified patterns, and this is where you describe trends or themes, provide evidence for every pattern for credibility of the data collected, and you must include contradictory data for rigour to provide an unbiased account of that case. But providing contradictory or data that doesn't fit is relevant for every research design because it adds rigour, quality, trustworthiness to the data. And when I say every, I mean every qualitative research design. Connection to a larger scheme of things. Basically what it means is, does it answer the research question? And how does the case add to the body of knowledge? You compare how the case study relates to other research, which either says, yes, it does verify the study, or no, it doesn't verify the study because it refutes the data from other studies. This is critical analysis. So the principles related to pragmatism, or being practical or clinical, offers an attractive philosophical framework for qualitative research as a healthcare approach. Underpinning qualitative research methodologies with a pragmatic philosophy has got significant implications for how nursing knowledge is created and employed. A pragmatic approach to qualitative research allows you for the consideration of multiple theories, ideas, and perspectives which focus on the usefulness of this knowledge to create new nursing knowledge or validate previous nursing knowledge that was inadequate. Okay, thanks everybody. As previously, if you found this session worthwhile, check out some of the other Dr. Manny Leanshops on YouTube. Okay, bye for now.